Hello! It's been a minute since I've made a video, I think. But hi. This video is really not going to be about mental health, more about dental health. But there will be mental health mentions in the video, but whatever. If you don't, you can click off it. Like, I'm just making this video. I have questions, concerns, and just things I want to talk about. So here we go. So if you're new here, hi. I'm 28 years old and I have periodontal disease, which means all of my teeth, not all of them, but pretty much all of my teeth are gonna fall out because my gums are just super infected, and they've been infected for a very long time. I started losing my teeth when I was 18 in May of 2013, so it'll be 10 years in a couple months since I started losing my teeth. I firmly believe it was just due to neglect on my behalf because of my mental health. I have severe agoraphobia, which is an anxiety disorder, and I have lots of anxiety disorders that coincide with that, and just I'm kind of mentally not all there. That being said, I was homebound for 5 years, and during those 5 years, I admittedly did not really take care of my teeth. And in the third year of being homebound, like halfway through, that's when I started having really bad problems and they started breaking off. I was never really taught proper oral hygiene. There was a lot of neglect on my parents' behalf. I was only taken to the dentist one time when I was 8 years old for a cleaning, and my teeth were fine at that age, at that point. I went again when I was 9 to a different dentist, and this is where things went downhill. She was very mean. She wouldn't let my mom come back with me, which is super weird because even now, like, as an adult, they let my parents come with me. Like, I don't understand. But she made my mom wait in the waiting room, and I was super, super nervous. She yelled at me. I was bawling my eyes out, begging for my mom. She was like berating me. She actually choked me. A lot of just, she kicked me out because I refused to like open my mouth eventually. Like I was like, fuck this. Like I'm kind of done. And I didn't go back to the dentist until I was 24 years old. So it took me 15 years to muster up the courage to go back to the dentist as a full-grown adult now. And at the age of 24, I was kind of fucked. I went to a dentist. They told me they couldn't help me, and they had to refer me to a sedation dentistry because my anxiety and trauma was like just too bad. I'd flinch anytime like this dude got near my mouth. It was just, it was my first time going to the dentist in 15 years after that really bad experience I had as a kid. I was never forced to brush my teeth, never forced to go to the dentist. Like, so you get my point, right? I didn't understand the importance. It was never really ingrained in me or in my brother either. My brother went to the dentist for the first time when he was 18 years old. I actually was the one that got him to start brushing his teeth because I told him you don't want to end up like me. And I think I scared him to the point where he started brushing his teeth. Not my parents. So, anyways, 24 years old, back in 2018, I went to the dentist and he told me I'm gonna lose all my teeth and I have to get dentures and they were gonna be $25,000 and blah 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 blah, and like that was it. And I was like, there's just no way. There's no way. I wanted implants, if anything. I've always wanted implants. Dentures, I've always thought, I'm too young for dentures, blah blah. I asked what implants. They laughed in my face and told me it'd be about 50 to 60 grand. And I was like, well, fuck that. So I just gave up and I got sicker and sicker as the years went on. I lost more teeth. I went to the emergency room, I don't even know how many times, to get more clindamycin. I've taken so much clindamycin over the past couple of years because I'm allergic to penicillin and amoxicillin. So clindamycin is like, I've had so many abscesses, so many infections. I'm currently fighting off like 2.5 infections at the moment. I've roughly like got less than like 10 hours of sleep in the past 2 days because I've been in so much fucking pain. Like, does my face look a little swollen? It feels like a little golf ball is like right here. I've been taking clindamycin. It's been a struggle, but I've been working with this place since 2021. Can I just get to the point, right? They are like a facial surgical place. They do implants, facial reconstructive surgery, etc. And I partnered up with them and a dentist nearby. Last March, I got impressions done for dentures. And the prices were much more reasonable. I'm going to be completely honest about the prices because I always see people asking, like, how much does it cost to get it done? So, my upper denture, full upper denture, was $1,500 for the immediate denture. I'm only getting an immediate denture. I'm getting full mouth extractions. Not full mouth. I just lied. I'm getting my uppers fully extracted and then some extractions on my bottoms. Actually, this was taken a week ago. It looks like I have more teeth than I do. I actually only have 4 teeth on top. These 2 and then like 2 kind of in the back, but I'm missing both molars, so as you can see, possibly. And my bottoms are just fucked. But these are good. Surprisingly, like there's no decay, nothing. So they're keeping these bottom teeth. I've never had the money to be able to do the surgery itself. The first surgery has now gone up to $11,000 for the extraction, the bone grafting, and being put out via IV because they will not work on me awake. And I don't blame them because I would fight everyone in that dentist. I would fight everyone at that surgical place. Like, I have an extreme fear. So I do that. I get my teeth extracted. I get the immediate denture if I want. They told me it's optional. And I heal for a couple months. I go back in if my gums are healed enough within 3 months. She said about 3 to 4 months. Then I do implants. And I do the, like, what's it called? The crowns that are not your permanents, temporaries. That's what they're fucking called. And then obviously let that all heal, and then I will get my permanent crowns for my implants, which I get it. I did a CT scan for my bone last week, and I have enough bone for implants, so I was really, really happy. They're doing all on 6, which I'm very happy about that too. But the first step is getting the fucking teeth extracted. And my aunt has been generous enough to realize how sick I've gotten. In the past month and a half or so, I've lost a lot of weight because I can't eat. I miss eating so many foods. Like, I've been on basically a soft food diet since before Christmas, since like the beginning of December. I haven't been able to eat really much of anything, and I've been basically starving for like the past 2 months. You probably can't tell, but I have lost a significant amount of weight. my personal trainer at the gym is even like, she said she's like kind of worried, and she's noticed like a drastic change in my measurements and everything. I can't help it. I cannot fucking eat. I can't chew. I have infections. I'm in pain. What am I supposed to do? I've lost like 2-3 teeth since like December. I'm just out here trying to live. So my aunt is going to pay for my surgeries. And contacted the dentist yesterday because I did impressions for dentures last March, so almost a whole year ago. I paid them off in May. And yes, they were $1,500 for the top denture. And they said that they have them because I wasn't sure like how it worked. They said I need to get my dentures and then make sure I can get my dentures and then schedule the surgery. And they told me I can come get the dentures whenever I need to get them. So now it's just scheduling the surgery. So, hey, I've been watching a lot of videos, a lot of stories about people who have gotten their teeth extracted, gotten dentures, implants, etc. I feel like I've waited so long for this to happen, and I'm beyond ready to stop being like in pain, because the amount of pain that I'm in every day, like the infection, I taste it, I feel it, it's really not fun. It's not fun at all. And it's something I try so heavily to hide. Like, I go in public still wearing a mask. I go to the gym wearing a mask, and people give me looks. I'm sure they probably think I'm some fucking but I'm not. I just don't want anyone to see this, and I'm exposing it here on YouTube because I want to be raw and authentic. And so I'm terrified, right? Now that I actually am able to do the surgery, I like don't want to do it. I want to do it, but I don't want to do it. Like, two things can be true at once, right? Like, I think about how much better my life will be afterwards. Like, I can eat and smile and not be in pain, which are like the three things like I want so badly. My confidence will go up. I don't have to wear a mask everywhere anymore. I can talk to people. I feel like my teeth situation has also made my agoraphobia worse, because like I don't want to go anywhere. I don't want to go out in public. I don't want anyone to see me. I don't want to make friends. I don't want to, because like, why would I want to, you know? I feel like it'll literally change my life super, super drastically. Obviously. But I am so scared because I'm gonna be put to sleep and then wake up and not know what to expect. I'm waking up to a whole new mouth. And so my mouth, this is gonna sound really weird, my mouth is like a huge trigger point for me. I'm currently not chewing gum, but I usually am chewing gum. If you watch like any of my videos, I'm chewing gum probably in 99% of them. It helps me relieve anxiety, stress. Probably doesn't help with my teeth either, and I don't even care at this point because they're fucked anyways. I have a huge thing with my mouth being numb. I actually went to the ER back in September because I had a really bad anxiety attack, and my mouth was like numb, my face was numb, my tongue was numb. It lasted for like 2.5 hours. it literally felt like I had all the symptoms almost of like a stroke. And I'm not actually kidding. They thought I was having a stroke, but it was just an anxiety attack. And so my mind correlates numbness, especially in my mouth and my face, with anxiety. And I know for a fact I'm going to wake up and my mouth is going to be numb and my tongue is going to be numb. And as you can see, I'm getting very visibly uncomfortable even thinking about that. My friend went to the same place that I'm going to get her wisdom teeth. She had impacted wisdom teeth removed, and she said she was only numb for about like an hour, maybe 2 after leaving. But then I see some people say they're numb for like longer than that. So I just want to hear anyone talk about that. I've tried to tell the oral surgeon that I'm terrified, and he thinks I'm scared of the pain. I'm not scared of the pain. I think people think I'm a little crazy when I say that, because I'm not scared of the pain. I'm not scared of being in pain afterwards. I know I'm going to be in pain, but it's going to be temporary and worth it. I'm in so much pain right now that like the thought of being in pain after surgery is not even, it's like the least of my worries. Is that weird? I don't know. It's just the immediate, like when I wake up, like the first like day or 2. And obviously like getting used to talking again, eating again, all of that jazz. Having dentures for a couple months. I mean, I can go denture free if I want to, but I thought that none of that really seems that appealing, I'm not gonna lie. But then I keep thinking, just get through that and you can get implants, which is what I wanted, and then you'll be so much happier, right? Like, that'll be good. Gotta get through the shitty stuff first. So I'm scared. I'm so scared. So yeah, my next step is just calling and scheduling the surgery, and I'm avoiding it. I'm avoiding it because I'm terrified that I'm gonna die. I've never had surgery done in my life. And it's because I feel like people are probably like, oh wow, she's such a fucking baby. So I have severe dental trauma and severe anxiety disorders, you know. I've never been under the knife. I've never had any sort of surgery. I've never been knocked out. I've never had anesthesia. I've never had anything like this done. And like I said, the most work I've ever had done at a dentist office was a cleaning when I was 8 years old. And then impressions for dentures last year. It's not a whole lot, you know, like I don't have a whole lot of experience with the dentist. I don't have a whole lot of experience with any of this stuff, and it freaks me out so bad. And I can't avoid it because the infection can literally kill me if I avoid it anymore. So I know I have to get my mouth treated properly. Yeah. This video was all over the place. I'm very sorry. And it's probably gonna end up being like I think it's gonna go up more, because initially when I went a little over a year ago, the estimate quote was 14 grand for the all-on-4s. Now they want to do all-on-6. And I noticed that for the dentures it went up, probably because I need more bone grafting. And I've lost more teeth, which means it costs more to extract like this than it does like this. Because they have to literally make incisions and like scrape in there, and they have to scrape up the infection anyways. Oh my god. So, and then also he wants to put implants in my bottom. think he said like 3 and 2, which makes sense. Yeah. So we're looking at like 30 grand in total for the, I guess it's 3 surgeries. Is it? Because we have the extraction, which is like the main one. And after that, we have the implant placements where they screw the screws in. And then the third one where they put in, I feel like they just kind of changed the crowns. I could be wrong. So but I gotta get through this first one first. Otherwise I'm never gonna make it to the second, third one. And then part of me is like, just kill yourself now and save everyone the trouble. Because there's no reason for my mouth to be 30 grand worth, you know? That's ridiculous. Anyways, and if you're wondering, I don't have dental insurance. I have bad credit, so I couldn't apply for credit care even if I wanted to. My aunt is going to do all that for me. I mean, she's paying out of pocket for the first one, and then she's going to do care credit for the second one. I don't have dental insurance. Medicare, I'm on disability. It doesn't cover anything dental that I need done. They consider it all fucking cosmetic, although clearly it's not cosmetic. I wish I could just have my old teeth back. I mean, technically it's cosmetic, but like medically cosmetic, like I could die if I don't get it. I don't fucking know. So I'm stressing out a lot. It's been on my mind a lot these past 2 weeks, especially now that I've gone to my appointments and I've done everything I needed to do except schedule the damn appointment. So that's it. Thank you for coming to my TED Talk. I hope you're all doing well. Happy 2023. I don't think I've made a video at all this year. I'm sorry this is long and I'm emotional. It's a big thing going on in my life, and I've had a lot of things going on in my life lately that have not been good and very overwhelming, and I'm just kind of going through it derogatory. But this is just a thing, and it'll be a positive thing if I make it that, but I don't know how to make it that. So if anyone can help, please, because I'm very scared. Thank you. I don't want to smile, it's so bad.